Minister, I'd like to ask you about another really serious issue, which is the ongoing transmission of COVID-19 in our healthcare facilities in New South Wales. You would remember that I wrote to you back on the 17th of January.
You did.
With the anecdotes of people who've contacted me.
And I think you raised this at the last hearing too.
I did
from
also
memory
raise it at
when
the
I
last
was
hearing.
reading through the transcript previously.
Well remembered.
Yeah.
I've spoken recently with the spouse of a patient with immunocompromised who was nursed by unmasked staff in a surgical setting despite making specific requests for staff caring for this patient to wear masks. And I've also spoken with a mother whose child was infected with COVID during an inpatient stay for a complex medical condition. I'm really concerned that the onus is being placed on vulnerable people and their carers to protect themselves from infection rather than the system protecting them from infection. In your response to my letter, which I received in a really timely manner, and I thank you for that,
We're trying to improve
you quoted infection prevention and control policies which include the following. It says staff caring for or working in areas where there are vulnerable patients should consider using masks routinely when COVID-19 transmission increases. I mean, we know that COVID-19 transmission increased significantly over the summer holiday period. Do you think that it's sufficient that staff need to consider using masks, or are we at a point where COVID transmission has actually increased enough that staff should be wearing masks in clinical areas with vulnerable patients?
Okay, so I'll refer to my colleague Dr. Chant on this matter, but I will just say a few opening comments. We have seen increases in the order of moderate to high, I suppose, in terms of COVID transmission at the moment. We are sending all of those messages and all of that data gets provided to local health districts around the importance of looking after vulnerable patients and vulnerable members of the community who may come into that hospital. I'll ask Dr. Chant to elaborate, but I don't want the committee to at all think in any way, shape or form that we are not taking the challenge of COVID seriously, but we are as a community learning to live with it. That includes in our hospital and vulnerable settings, but we do have measures in place to what I would call protect as much as possible the most vulnerable people in our community, and they're often people who are elderly or in our hospitals. Dr. Chan?
So the Clinical Excellence Commission deals with the infection prevention and control recommendations for the hospital, which gives an ability for the hospitals to tailor, as you've described there, what might happen with around a vulnerable patient, or particularly services that service and cater for vulnerable people, a much higher level of stringency in terms of the recommendations. I'm happy to take on those examples if you'd like to provide them, just to feedback and investigate the sort of infection control prevention strategies in place. And I think it's really important because we, as you know, even in a surgical, a day patient setting, there may be patients that are vulnerable. So very happy to take that on board. We are also just making sure that people understand, particularly our visitors to our hospitals, not to attend healthcare facilities when they have any coughs or colds. We've also got recommendations around if you've been a household contact, because we know transmission is very significant within households, to be particularly cautious, do RAT tests, and seek advice from the facility before attending. Just also to reassure you that if someone has got COVID and there's someone in an end-of-life setting or other things, our infection control practitioners and our ID specialists can also work at how we can arrange visits, because we are in that stage of balancing risks and how we can do that safely. But I'm happy to take those examples offline.
And I'm happy to share confidentially those examples with you. I'm certainly not reassured at this stage, particularly based on the answers at previous estimates, that we're not actually aggregating statewide the rates of hospital-acquired COVID-19, as has been done in, for example, Victoria, where we know there was a 10% mortality rate. So I'm concerned that this could be happening in New South Wales and we're not even aware. I just wanted to follow up on another bit of that protocol in the letter, Minister, that it said if patients or carers request staff members to wear a mask for an individual patient, staff need to consider this request as part of the risk assessment. Surely it's like a really, really low bar that would be very easy to implement, to say that if patients and carers actually request staff members to wear a mask for an individual patient, that staff must actually adhere to that request.
Well, I think corrected. I mean, a lot of hospitals over the course of a week, I certainly would be under the assumption that if a visitor or a patient asked for that a staff member would generally do that. I have a lot of trust in healthcare professionals and their judgment around the patients they're caring for. I couldn't imagine that would not be the case, and I've been in hospitals plenty of times where they have masks in place because of the COVID activity within their community, and people walked in have always complied. But Dr. Chan, do you have anything to add to that?
I suppose just from the public messaging perspective, we do actually strongly support that the community to adopt any request to wear masks in any facility. So just being that when we're messaging around GP surgeries and other settings, dental surgeries. So when we are supporting that masks are one of the risk mitigants that visitors and patients may be asked to put on in healthcare settings as well. So that's the public-facing component of it.
Thank you. Look, I'm about to move on, Minister, but I do urge you to consider this. I've been speaking directly to immunocompromised patients who have requested New South Wales Health staff members wear a mask and have had that request denied. So it's clearly not happening uniformly across the board, but acknowledging that the vast majority of staff do take appropriate precautions.
No.
Dr. Chant, you raised the public messaging on COVID. I was hoping to table this copy of a tweet that I wanted to ask some questions about. This is a post on Twitter from New South Wales Health with advice to prevent COVID-19 transmission at back to school time. In your letter to me, you wrote that key messages for the public include staying home if unwell, but the tweet, as you'll see, encourages children to sneeze or cough into their elbow and to wash their hands. Is that the most effective way to prevent the transmission of COVID in schools?
No. So just to be very clear, the messages are that if you have an unwell child with a cough illness, whether it's COVID, RSV, respiratory syncytial virus, or whether it's influenza or another respiratory virus, we would urge parents to keep their child home. We don't want to see germs spread around in schools. The role of hand washing is less significant in COVID transmission, but we know that as we move into our winter campaigns, we will be emphasising hand wash because it does play some role in flu and RSV transmission and other enteroviruses associated with gastro and other things. So maintaining good hand washing is a good behaviour to adopt, but again, not really relevant as much for COVID. And at the moment, we have low levels of RSV and influenza, although the latest report that we issued today does show that RSV is starting to increase.
Thank you, Dr. Chan. I'll just come back to the Minister.
Yeah.
Don't you think that kind of messaging from New South Wales Health is actually implying that it's okay for kids with a cough to be at school as long as they're being encouraged to cough into their elbow?
Well, look, I mean, that could be interpreted that way. I interpret that slightly differently, and I accept, I'm not denying that that's perhaps the way you interpret it. People can sometimes cough and sneeze and not be unwell. That's the nature of the seasons, and pollen and whatnot can mean that. Having two young children, I certainly emphasise those two rules, most of which at times they're not always followed. So I think it was more general around that if you need to sneeze at school, to do that in a way that reduces the chance. I'm not sure it's sort of saying go to school unwell, but if people interpreted that, then that's people's interpretation, and we'll have a look at that communication and see if we can improve it. But I also don't want to necessarily criticise some of my staff who may have worked through that, because in their context they may have been thinking that some awareness around general hygienic behaviours within a school environment is important. That's all.
And I think just to reassure you that we're aware of that. We do monitor the feedback and the understandability of the tweets and the context, and that's probably one where we could have done better, just particularly in the context of the messaging with COVID. So just to assure you that we are working collaboratively, informed by insights, consumer insights about where there may be knowledge gaps to make it more accessible to the community, and we'll do better. The messaging today's was really around staying up to date with your immunisation. Stay at home if you have cold or flu symptoms, and wear a mask if you need to leave home. Gather outdoors or in well-ventilated indoor spaces, and talk with your doctor now if you're at high risk of severe illness from COVID and other respiratory viruses. You may need a PCR test and be eligible for antivirals. So they're the comprehensive core messages that have gone out this morning.
Yeah, thank you. That's more consistent with what was in the letter I received from the Minister in January. I've raised that tweet and in the context of our earlier discussion about masks in healthcare facilities. I'm really concerned this is part of a trend about individual responsibility of vulnerable people and their families to protect themselves, rather than a systemic responsibility to look after vulnerable people when they're in public settings, and particularly New South Wales health settings. The Senate inquiry into long COVID recommended implementing measures to assess and improve indoor air quality and ventilation in high-risk settings, and that would particularly include New South Wales health facilities. What work's being done to progress implementing that recommendation?
We will have a look at that recommendation. I'm happy for other officials to jump in after me on it, but in all of the development of our new hospitals, ventilation is critically important. We know that as a result of COVID, just how critically important it is. We have put in place some of the anti-pressure rooms that allow almost a protective seal around patients, so that transmission of things from the corridor doesn't necessarily get into the patient's room, which is important. But this is obviously, these recommendations are obviously for a national-led approach. New South Wales, as it always does, will participate and engage in terms of the co-design around that. But I'd want to make sure the committee understand that we always take the safety of patients, including making sure they're safe from hospital-acquired
Minister, if I could
infections,
just ask you to be more
very
specific.
seriously.
I'm very pleased to hear that this is being considered in all new hospitals, as it should be. It's a really important lesson for us to learn from the pandemic. Is there any work being done to actually look at retrofitting existing hospitals, noting that some of them have quite poor ventilation?
Dr. Chant, do we...
So obviously health infrastructure complies with the standards, and Rebecca can talk about the national standards and the work done. Obviously the growth in the single rooms in our facilities, particularly in our new builds. We're also aware of some research that's being undertaken, and I've requested a preliminary briefing for Health Share and our Clinical Excellence Commission on any preliminary learnings from that work. It's across a couple of our facilities. So again, we're very keen to learn about that. I think that there's been a lot of reflections on the new builds in terms of design considerations that may be impacted to reduce the burden of respiratory illnesses. So Rebecca, did you want to comment?
Thanks. Certainly during the pandemic and subsequently, excuse me, there's a community of practice which has been established, and there have been some recommendations that have come from that. There were specific...
Thank you, Ms Watt. I'm really sorry to cut you off. I'd actually love to come back to this afternoon, but I'm very short on time with the Minister this morning.